that the Michigan Department of Health and Human Services was reviewing the status of businesses that remain closed in various parts of the state. Where is that now, and are gyms and movie theaters and other businesses that have been shut 6 months going to be able to reopen soon?
Yeah, so I'll just make a few observations here. We know that there is a lot of pressure, of course, on our business owners as well as on decision makers and on our public health officials. We're going to continue to make decisions based on facts and data and recommendations from health experts like Dr. Khaldun and the University of Michigan Public Health, et cetera. Because we took aggressive action early on to fight this virus, our state is faring a lot better than a lot of states are right now. MLive reported this month that despite being one of the hardest hit states early on, we currently rank 40th in the nation in terms of 7-day average of new coronavirus cases per capita, and 40th in the number that are testing positive on the diagnostic tests. Those are good pieces of information, positive pieces of information. Yesterday, CNN Business published a ranking of states' economies that are getting back on track, and Michigan ranked number 7 in the nation. And that's a testament to the work that we've done. It's a testament to following the science, and it's a testament to the people of Michigan taking this seriously and doing the right thing. The economy in Michigan is operating at 87% of where it was in early March. So that's a powerful story to tell. Certainly, we know that all of this success is precarious, that we can see these numbers move real quickly in the other direction. And that's why watching these 7-day averages is really important. That is why the context is really important. It is also why we are assessing if there are sufficient protocols around businesses that have not yet been engaged to see if we can start to re-engage at some level on those fronts. I'm not going to be bullied into making that decision. I'm going to follow the science. I'm going to work with Dr. Khaldun, but we are looking very closely at those businesses that have been closed for the duration to determine if those protocols are there and if the 7-day averages and the number of positive cases per million per day would support doing a little bit more on those fronts. But there's no decision that I'm announcing today. It is something that we are continuing to scrutinize and determine if it's safe to move forward. And so I am in earnest looking at that, working with the department, working with Dr. Khaldun on those fronts. It's too early to say yet.
Okay, the next question comes from Dave Eggert with the Associated Press.
Governor, to follow up on that, and this could be a question for you and Dr. Khaldun, have the businesses that have, some of those businesses that have not opened in much of the state have opened in northern Michigan. Have you seen evidence of any outbreaks in bowling alleys, gyms, movie theaters?
I can't give you data off the top of my head with regard to bowling alleys and gyms specifically in those regions, but I think you're asking a good question, David, and we will definitely share more detail with you. You can see it on the website, but I can't tell you off the top of my head. Could you, Dr. Joe?
There are some, but I don't have the exact
Yeah,
numbers.
we have, certainly there are gyms that are flouting the law and have seen outbreaks, and they've closed within days of when they've opened. I know that when you look at consumer confidence and you look at how we've re-engaged our economy, you can tell that we're in a stronger position than a lot of other states because people have to know that they're going to be safe. And so it is on the business owner as much as it is on the customers to ensure that we're masking up and we're keeping one another safe. And I think that that's a big issue in places that open and don't follow the rules and then have an outbreak. I think that we know that they're going to struggle for a longer period of time because of the fact that it wasn't safe to re-engage. So just a couple of observations. But Dave, we'll follow up with you with a little more information on that specific question. But I invite you to check out the website. There's a lot of detail on there that you can see.